Assalamualaikum and good afternoon. My name is Kamarul Al-Haq bin Abdul Ghani. I'm an orthopedic consultant in Advanced Trauma in HTA Klang. I'm a government servant in KKM and Ministry of Health Malaysia, and I've been going to projects in Medicines Sans Frontiers or Doctors Without Borders since 2015 until today, and a few NGOs, local NGOs before that. So I've been to several countries in Iraq, Syria and Afghanistan for several months to work there, and had experience in during conflict and also peaceful time reconstructive surgeries. And that's all.
Thank you. It's impressive. Sushila?
Hi, I'm Dr. Sushila. I've been working with refugees for the past 20 years now. Didn't actually start out to do that, but eventually the path opened for me. I've done a master's in public health with the London School of Hygiene and had my medical degree from India. And initially started with a volunteer group in Malaysia to provide medical services for refugees back in 2002. And eventually that became a local NGO, a small local NGO. Following that, I joined Doctors Without Borders, who was in Malaysia at that time in 2005-06, and I was their regular doctor for clinical work for refugees. Then I joined UNHCR. I've been with them since for 16 years, doing public health coordination work, which encompasses a wide scope of work competencies. And with them, I've been doing some emergency work as well to Uganda and Bangladesh for some of the refugee emergencies that we handle. To you, Dato.
All right. Dato?
Assalamualaikum. Hi, a very good afternoon. I'm Faisal. To cut a very long story short, okay, I've been with Mercy Malaysia for 20 over years. I have been the president now for 14 years. Inshallah, for not very too much longer, hopefully. I think where I'm coming in with this conference and with this particular session is very focused on sharing with you, as with my colleagues will as well, the humanitarian system, its ecosystem a bit, not too much because that will be a lecture of its own, but also just enough to give you a glimpse of what is there, and then to talk about the possible careers and career pathways, which I'm suspecting most of us are not aware of, or if we are, we're only aware of parts of them. And especially so that most of us will not be aware that there is actually a whole career to be made in the humanitarian sector, regardless of what degree you hold, but especially if you hold a medical or health-related degree. Yeah. So, and that is related to, but actually separate from just volunteering, which is another aspect altogether, which we will also touch on. Thank you.
All right. Thank you very much. Okay, with that, we're going to go with our Q&A session. So first question, and to benefit everyone that is in the hall today, in the past 2 days, there's always a lot of question on why am I doing this? What's next for me? So perhaps the first question would be, what motivated each of you to pursue a career in humanitarian work, and how has this journey enriched your professional and personal life? So, yeah. Dato, you want to start first? Yeah.
I still remember the date because it's easy to remember significant dates in your life. So on the 4th of January 2003, I decided to volunteer I decided to volunteer with Mercy Malaysia. I attended one of their volunteer induction programs. Prior to that, between 1999 and 2003, Mercy Malaysia was founded in 1999. I actually already knew about Mercy Malaysia, but I couldn't volunteer. Why do you think? Because I was busy. Because I was doing my masters. Okay? Because I was finishing my masters, and after I finished my masters, became a specialist. I was the senior registrar and a clinical specialist, which, as you know, is the busiest time of your life. Okay? Therefore, then you cannot volunteer. So that's why I volunteered on the 4th of January 2003. I was already fully gazetted, full-fledged respiratory physician already by that time. A bit faster than the rest because I was in university. So, so that's how it began. I was a volunteer. I still technically am a volunteer. I'm not paid by Mercy Malaysia, although I've been leading the organization for the last 14 years. Took over from Jamila, that's Tan-Sri Jamila to most of you, in 2009. What motivated me? I guess when I have to go back, I guess, to even further back to 1985 after my SPM, I guess. That's how long I have to go back. Yeah. Which is, and I will try to keep it short. Yeah. Basically, I could have done anything between engineering and law, and anything in between. The reason why I chose medicine, and because I chose medicine, I stayed here in Malaysia and not flew overseas like most of my colleagues at that time, was because I wanted to do something with people and I wanted to help people. So that's the reason. That's the reason, basically. But as I became a doctor and became a professional doctor, I realized that it's a profession. It's work. Yeah. And after a while, the vocation and the emotional part of it went by. Yes. And people can die in front of me and I don't feel anything. Yes. Because it's work. So what? Yes. You're just a number. Yeah? The next patient is just a number. Yes. So I decided because I wanted to do something more meaningful. So that's it. Yeah. And yes, it is meaningful to do this. If I could rewind, ladies and gentlemen, if I could rewind, I would do this work full time. And I'm so envious of Sushila because she can. Because she can. I couldn't because by the time Mercy Malaysia grew enough, and by the time I had grown enough in the sector, it was a bit too late for me. It was a bit too late, if you can understand that, from a personal perspective. Yeah? But I always tell my people in Mercy Malaysia that if you have the chance, you have the chance of a lifetime here. I would grab what you have now, if I had the chance, but I can't. At the moment, if I were to do this professionally, I have to leave Mercy Malaysia and, like my predecessor Jamila, go to Geneva, go to New York and take up a very senior position in international organization. I can still do it, not too late, but there are still things here I need to take care of. Yeah. So that's about it. So that's why I'm doing this, and it is a profession there. There is a pathway there for people who want to do it.
Dr. Sushila?
Okay. Winding back that far back, 1985, yeah, SPM as well. Decision between music and medicine, very diverse. But medicine also because my dad was a practicing family physician, I was very much influenced. But then again, that question, I think some of you may be children of doctors, they will be like, you're expected to follow a certain path. So I did do medicine mainly because there was still that I felt I could do more with medicine. Music was, something that I could still come back to in the future. And then really I went on to practicing medicine in HKL and came back from India. And it was at some point in the hematology ward when it struck me like, what am I doing here? This is not for me. Even though I had been very much a clinical person, I was so bent on doing clinical work and did my MRCP as well, first part, and then I decided, okay, I have to be true to myself, get out. I didn't know where I was headed, but eventually the work kind of found me. Someone asked me, would you like to help in a clinic? This was just a group of people from faith-based organizations. We need a doctor to run a clinic for refugees in the jungles of Putrajaya. It's like, we have refugees? I didn't know all that, but that has really then took a different turn in my life, and I became a regular volunteer, which eventually I decided that I want to do this full time, and MSF came in at that time as well, but MSF Belgium, Doctors Without Borders, and we started having a mission here that ran clinics for refugees around.